Krishnan. I'm consultant in Apollo Cradle Jubilee Hills, Hyderabad. Today I'm going to discuss about fibroid and its symptoms and when to meet your gynecologist. So fibroids, these are the non-cancerous growth of the uterus. They're usually seen in the childbearing age, and these developing into the cancer are very, very rare. These are the main, I can say, these are the most common problem patients usually visit the gynecologist. Okay, so they manifest in different ways, they grow also in different sizes. It might be in the small size with the big size, and it may develop as a single fibroid, or in some patients it may have multiple fibroids. In some patients it might be asymptomatic, and in some patients even the small fibroid cause symptoms. So what are the types of fibroids? It might be intramural, which grow from the muscle layer of the uterus cavity, and these is the most common type of the fibroids. And second type is subserosal, which grow outside the uterus, and they are called from the serosal layer of the uterus, and these are not that symptomatic. Coming to the submucosal, which grows from the uterus muscle and they protrude into the cavity, and these are the fibroids which are the culprits for the painful periods or infertility problems. So there are other fibroids like cervical and broad ligament, very less commonly seen. And coming to the symptoms of the fibroid, patients may present with the heavy painful periods, uterine cramps, and sometimes they feel lump in the abdomen, and some people have difficulty in passing urine and increase in the frequency of the urine, or some people may have constipation also. So these are the things usually they present to the hospital. So when sometimes the patient may incidentally we find out the fibroids in the scan, so they may be asymptomatic also. So coming to the management, it is not always to treat all the fibroids. If the fibroids are asymptomatic and small size and they're not growing, it's better not to touch. Management always depends upon other factors like age, location of the fibroid, size of the fibroid, type of the fibroids, and whether the patient is desiring for the pregnancy, is that going to affect the pregnancy. These are all factors we take into consideration and we treat accordingly. There are medical and surgical managements. Accordingly, what is needed to the patient, we will see the scan or whatever the symptoms, and we will manage. So like I explained previously, whatever the symptoms you have, please come to the gynecologist and get treated, and don't worry, because these fibroids are treatable. Thank you.